Inversion therapy, does it work? How does it work? What are the benefits and what are the contraindications? I've got that information coming for you right now. Stick around. I'm going to get upside down. I'm Penny Morgan. My channel is Stay Body Positive, and I'm a healthy alternative strategist. If that interests you, please make sure to hit the subscribe button so you don't miss any videos or updates. Inversion therapy is very beneficial. Consult your physician familiar with your case history before starting inversion therapy. Depending on the inversion table that you have, it will have varying different degrees of inversion. My table actually starts at 15 degrees, 30, 45, 60, 85. So I actually have it set to 85 degrees and I use it daily for 7 minutes, and then we're going to talk about why I use it daily for 7 minutes. The benefits of inversion therapy. Gravity does put pressure on our spine over time, and it certainly will start to compress the disc. People like me turn to inversion therapy to give space in the spinal column again so that it isn't putting pressure on nerves like the sciatic nerve. Ultimately, this translates to more comfortable and more flexibility in our movement throughout the day. Reducing chronic back pain. Many of us are looking for a non-invasive way to comfortably reduce lower back pain and or sciatica. Help improve muscle spasms that one might encounter due to back-related issues as well too. You should always consult your physician or a chiropractor before beginning inversion therapy. All inversion tables have a variety of adjustments. As you can see, this is the angle adjustment here. And you also have a height adjustment based on the individual's height for the backrest. And of course, this is the foot adjustment. To get into the inversion table, simply step on the footrest. And for this table, just pull the handle and lock in the feet. This will vary to some degree on all inversion tables, but they're basically all very similar. Most days, I only use it once a day, and that is first thing in the morning. Now, why do I use it first thing in the morning? Well, I use it first thing in the morning because my stomach is empty. I want to make sure that I'm on the table with an empty stomach. I don't want to just eat or drink a bunch of water and then get on the table, because that is not good for the digestive tract to invert after you have just eaten. Before I get on the inversion table of the morning, I heat the back up. I get a much better inversion therapy by having the muscles warmed up and loosened up when I do get on the table. So I simply just heat the back up by getting on a heating pad for about 5 minutes before I get on the inversion table. Now, on those days that I'm having some issues, maybe the pain is a little more intense or the sciatica is a little bit worse, I will get back on the heating pad for another 5 minutes after I come off the table. So I'm going to show you how I use it and how this works. Here we go. You can get comfortable on the table and get your feet locked in before you invert. So once you have your feet locked in, then you can go back into your inversion. And it's just very simply as laying back and inverting in the position that you have the table set in. So this is inversion therapy, and this is at an 85-degree angle. I can feel the decompression starting to occur on my lumbar area. And that's how simple an inversion table is to use. To get out of it, simply just unlock the feet and step off the table. I do recommend that when you come off of your inversion table, that you come off of it slowly, as in you rise back up at gradual increments, especially as you're getting used to inversion therapy. Once you do come off the table, I do recommend that you take a moment and sit down. Your balance can be off. Inversion therapy is short-term pain relief. It is not going to be something that is going to be long-term, and it is not a corrective action. It is simply maintenance therapy. The downside to inversion therapy is when I travel, I don't have my table with me. Now let's talk about the risk of inversion therapy. But before we do that, if you find the information in this video helpful, please feel free to share it. And if you would like to see more videos like this, hit the subscribe button and the notification bell so that you get notified whenever I do put out additional videos. Would love to hear your feedback and comments, and if you'll click right here, have a little survey and you can just answer a question really quickly for me on inversion therapy. Also note that I do have these other beneficial health videos. So now let's talk about the risk of inversion therapy. Some of the risks associated with inversion therapy, one of them is actually high blood pressure. So high blood pressure is actually a contraindication. That means that you should not do inversion therapy if you have high blood pressure. Hanging upside down does decrease heart rate while increasing blood flow to the brain, eyes, and inner ear. Because of this, inversion therapy is not recommended for those people who suffer from high blood pressure, heart disease, glaucoma, history of stroke, osteoporosis, hernia, broken bones, or obesity. People with conditions to the head, eyes, and ears should also avoid inversion therapy as well. For example, ear infections, eye infections, glaucoma, and retinal detachment. Inversion therapy may also be unsuitable for people taking blood clotting medications and/or blood pressure medication. And of course, inversion therapy is not recommended if you are pregnant. Takeaway: some people may find that inversion therapy is very beneficial to them for short-term pain relief on a consistent basis. It is relatively inexpensive. You simply have the cost of the table, and I think that I paid $69 for my table, but I did buy my table secondhand off of Craigslist. I do know that the table sold for $100 at Walmart. Inversion therapy and other alternative therapies should not be seen as guaranteed methods of treatment, but rather as supplements. I'm Penny Morgan. Stay body positive and reap the rewards.